So the Brexu-cel is a CD19 targeting CAR-T cell therapy that has been approved for relapsed and refractory mantle cell lymphoma in US and in many other countries. The US Lymphoma Consortium wanted to address the question whether patients treated in the standard of care practice will see similar efficacy compared with those patients who were treated in the pivotal trial. The reason being, in the standard of care practice, many patients have a lot of comorbidities that would have made them ineligible for trials. In other words, the standard of care practice patient population may be different than those treated in trial population. So this is a collaboration in a consortium involving 16 centers. In the end, we have 168 patients that were treated with Brexu-cel in the standard of care practice setting for relapsed and mantle cell lymphoma. What we observed that in terms of efficacy, the response rate and CR rate were very similar to the pivotal ZUMA-2 data. And also in terms of early follow-up, progression-free survival and overall survival, the efficacy data were also very similar to the ZUMA-2 pivotal trial data. What's interesting is if you look at patient eligibility for ZUMA-2, those who would have been ineligible for ZUMA-2 were the majority of the study population, up to 70 to 80%. Despite of that, these patients still benefited similarly to trial population. In terms of side effects, the rate of cytokine release syndrome and neurotoxicity were again similar to the ZUMA-2 data. We do have cytopenia and infection data and the non-relapsed mortality data that were described in more details in the paper. Then one interesting observation from this study is that the high-risk features unfortunately still predict a worse outcome, such as TP53 mutation, high MIPI score, and complex karyotype. So those patient population remain unmet need in our practice. The other interesting finding is that recent exposure to bendamustine seemed to impact the treatment outcome negatively. So those may have implications in how we choose treatment in the availability of CAR-T for some patients with relapsed disease.